Hi there. Looks like you came just in time. Sounds like there's a bit of a storm brewing out there. Did you end up getting caught in it? No, that's good. So, let me see here. Looks like we are doing a head and neck assessment today. Let me just take a look at your information that you filled out for us prior to the appointment. Okay. Looks like nothing major. So then all I have left to mark on here is just a little confirmation that you are the intended patient. So, would you mind just confirming your name and date of birth? Okay, and good. And is that the name you prefer to go by? Do you like a nickname or any other name? Okay. There we are. That's all I need from that. Our head and neck assessment is going to be pretty easy. I'm not going to have you do too many things. I'm mostly going to be taking a look at you. So I'd like to start with the head, the scalp area. We'll move on to the eyes. We'll do the ears, nose, mouth, throat, as well as getting into the neck and even a little bit into the shoulders as well. It's just very interconnected area. So the very first thing I want to do, just going to get my little light here, and we are going to look at the head and face as a whole. And what I'm looking for here, we are looking for your coloration. Is it a bit on the pale side? Is it hyperpigmented? Do you have any sort of sunburn, dark patches, things of that sort? We are looking at your proportions as well. So, are the eyes proportional to the face? Or is there any sort of swelling, or do they look smaller than usual? Same with the ears, the nose, the mouth. Are there any areas where things are not correct to your general proportions? And generally we're looking at things that are rather obvious. Everyone has different proportions, but there will be certain things that look just not quite right at all. And we're looking at your symmetry as well. So, looking at if maybe one eye is a little more closed than the other one, for example. Is one side of the face lower than the other, indicating maybe a palsy? That sort. And then we will be getting into the scalp, which is where I bring this in. So, first thing I want to do here, I'm just going to use the tail of this comb to poke through the hairline a bit. And for lesions or other little spots. Look for things like lice, of course. Pretty standard. Looking at how thick the hair is. And over in here, right around the ears. Nice and gentle. Good. And then just going to take my light here. Nice and bright. And we'll look through the hair, look at the scalp while I have this little light on. So that I have a good little look at everything. And do let me know if any of these spots are painful or tender at all. Right in here. Okay. Good. Now let me just look more with my hands. So I'm going to feel around the head, feel around the scalp. And just see if there are any odd little lumps or bumps or little raised spots, maybe any tender patches. Nice and slow. This side, the back here. Okay, excellent. Now, we are going to be looking at some of the cranial nerves as well. We'll tackle pretty much all of them before the optic nerve. Now, for cranial nerve number 7, the one we will start with. The one we will start with. This is your facial nerve, and it governs your ability to make facial expressions, has its little fibers in all of these muscles. So to test that, to see if there is any weakness or abnormality, I'm going to have you perform some different facial expressions. So if you could just follow along with what I do. I'm going to have you raise your eyebrows and raise them a couple of times. We'll see. Is there any weakness in one side or the other? We're looking for symmetry. Raise them. And then can you close your eyes real tight? Real tight. And with your teeth? Excellent. And can you frown? Okay, very good. Did any of that feel strange at all? Did it feel like any side was a little weaker than the other? No, it didn't look it at all. It all looked symmetrical, but I figured I would ask if you felt anything strange with any of that. Right. So now I'm going to be looking at your temporal arteries. We'll get into the motor aspect of the trigeminal nerve. Look at your muscles and mastication. Quite a few different bits. So, the temporal arteries, right in here, right along the temporalis muscle, and the sphenoid bone in here. So, I am going to just palpate right in here, if you don't mind, as I'm touching your face. Okay. And you don't need to do anything. Just feeling the pulsations here. Thunder's rather calming in the bit of rain. I know when it started it was a real driving rain, quite torrential, so I'm glad you didn't get caught up in that. It was so loud one could barely even think, even inside. Okay, so for the motor aspect of the trigeminal nerve, what this covers is your muscles of mastication, namely the masseter right in here, and the temporalis muscles. So, I'm going to have you clench the jaw, unclench, unclench. Good. Clench the jaw. Unclench. Clench. Unclench. Good. Did that feel strange or weak at all on any side? Did it feel like maybe one side was not as strong as the other? Was there anything odd? No, okay. It didn't feel odd. Again, I just want to hear your internal experience. Make sure we cover our bases. Now, we're going to assess the temporomandibular joint right in here. So we're going to do a little bit more with the jaw. What I'm going to have you do is I'm going to have you open and close your mouth, first without resistance. So if you could open the mouth, close, open, close. Good. Now I didn't feel or hear any clicking. Did you feel any of that at all? Okay. Was there any difficulty, any pain, any dysfunction here? Okay, I am going to put my fingers underneath your chin, and I am going to have you open your mouth against my resistance, and we'll see how that feels. If I could have you open the mouth, close, open, close. Good, okay. And with that bit of resistance, did that cause any pain, any dysfunction? Okay, I'm gonna have you move your jaw from side to side. It's gonna look a little odd, but I wanna see if there's any issue with the jaw in that. So if you could move to the left, right, left, so I did feel that movement. Was it painful for you at all? Okay, excellent. So why don't we take a look at your sinus cavities now? So I am going to be first pressing in on these cavities. I can't really get into ethmoid sinuses with my glasses like that, but the maxillary. So let me know if this is painful or tender at all. Along the frontal sinuses here. Any pain? Any tenderness? Okay, and how about along the ethmoid? Right along the nose there. Nothing there. Okay, and the maxillary now. How about that? No? Okay. Now I'm going to be tapping along these areas. This is a little bit of an exacerbation if you do have any sinus issues, more so than the pressure. Do let me know if there's any issues. So we're just going to tap along here. Any issues there? How about right in here? Nothing there. Good. Okay. That's good to hear. Now, let's go ahead and move on to your eyes. So, let's take a peek with the light. Just look right at my nose here. Good. Okay. So clear eyes, clear. Irises are real pretty. And eyelashes and eyebrows intact. And the lacrimal glands here. Clear, moist. Good. Okay. Just from below here. From above. Okay. Good. Good. Okay. So I am going to have you follow my tongue depressor here, and we're going to be testing cranial nerves 3, 4, and 6, the oculomotor, trochlear, and abducens. So how we're going to do that is I'm going to have you focus right here, okay? And I am going to have you just follow this with your eyes without moving your head. Good. Back here. Good. And right in here. Good. And bring that back. Just keep following this with just your eyes. Nice and slow. Good. Good. Just keep going. Very good. I'm going to bring this back a little bit. Just keep looking at this. Good. great. Right in here. And over here. Here. Just all over. Good. So now we'll bring out the light. We'll look at your direct consensual response. So we just did our eye movement as well as the accommodation reflex. I'm gonna put my hand right here. Just look straight ahead for me. Consensual. Consensual response. Consensual, good. Direct, okay. Direct. Consensual. Direct, good. Consensual. Consensual. Direct. Excellent. Now, for your ears, I'd like to take a look at them to start off. And then we will do a little bit of palpation. We'll take a look with the otoscope. But I just want to look at them to start. So, we're looking at the cartilage. We'll look at as well the back of the ears. Since you can't see that yourself, we can see if there are any lesions or any abnormal spots. Look right in here. Just looking. Just looking. Okay. And we're just going to do a little bit of palpation here. Is any of this painful or tender at all? Just let me know. Okay. Let's grab the otoscope. And we'll take a peek inside of the ears now. Look in here. There we are, a little bit better. Good. Right here. Good. Okay. Right. Looks great. I want to do a little whisper test, and it'll be a little interesting because we will have this bit of background noise, the thunderclaps, and that will actually aid a bit in our test, just to make sure that your hearing is intact, especially with background noise. I'm going to be whispering in your ears. I'd like you to just repeat what you hear. Apricot. Apple. Acorn. Adventure. Blossom. Blueberry. Bread. Big. Good. Cow. Cartilage. Carp. Cowl. Good. Dance. Dark. Dits. Done. Okay. Ether. Extra. Either. End. Far. Fluff. Frodo. Fun. Okay, and all of those sounded clear to you, even with everything else going on, the bits of rain, the thunderclaps. Okay, excellent. Now, let's move on to the nose, the mouth, and the throat. So, let's take off the speculum of the otoscope and we'll look inside the nose here. I'm gonna have you tip your head up so that I can look inside here. And we are not going inside the nasal passages, but instead we're just seated right outside, looking at the tissue of the nasal passages. Get a little bit of the turbinates in there. Right up in this area, we have the septum. No deviation or perforation. Do you happen to snore at night at all? Okay, good. And any breathing trouble? Any pain with your nose at all? I know we did a little bit with the sinuses. Any pain? Okay, so we are going to do a little breathing test. I'm going to occlude one side of the nose, and we are going to have you breathe through that side a couple of times. Switch to the other side, and we'll see how you breathe in each individual nasal passage. So, I'm going to have you just take a deep breath in and out. Deep breath in and out. Good. Other side. Deep breath in. Out. Deep breath in. And out. Okay. How was that? Was there any difficulty at all with either nasal passage? No. Okay. Very good. Now, I have some little samples of things that have distinct smells. And to test cranial nerve 1, we are going to see if you can determine those smells. edge of a tongue depressor, and I'm going to have you take a smell of this. Can you tell me what that is? Okay, that smells like lemon. And if we get a bit on the other side here, what about this one? Cinnamon, very good. Now, flip the tongue depressor. And I'm going to occlude one nostril. What does this smell like? Yeah, a little on the medicinal side. That would be clove, yes. Good. And how about right in here? Okay, orange. Excellent. And we'll flip that over once more and get to this one. Okay, just occlude this side. What does this smell like? A little spicy. Yeah. Chili, very good. And how about this one? Mint. Nice little palate cleanser. Okay, so let's go ahead and take a little look at the external mouth here. I want to look at the lips, the corner of the lips, the color. Looked for any chapped skin, any cold sores, lesions. Okay. Would you mind opening your mouth so I can see the corners of the mouth? Good. Okay. And then we'll take a look inside the mouth after we look at cranial nerve 12, hypoglossal nerve. This governs tongue movement. So I'm going to have you stick out your tongue. Okay? Can you move it to the right, to the left, up, and down? Good. And can you lift your tongue to the roof of your mouth? And okay, so the roof, or the floor of the mouth rather, looks healthy. Go ahead and put your tongue down. We'll get a new tongue depressor, and I'm just gonna have a little peek at the teeth. Good. And the buccal mucosa. Good. The roof of the mouth, we'll see what we can see. The hard and soft palate. Okay. And can you stick your tongue out as far as it'll go? That'll help flatten it so that we can see the uvula as well as the pharyngeal wall. Good. I'm just going to put tongue depressor right there. And there we are. So this will be awkward for just a little bit. Just looking at the throat wall, cobblestoning, irritation, color, presence of the tonsils. Okay, and when we look at the uvula here, I want you to say ah for me. Okay, so that's good for CN 9 and 10. Take this out. And I'm going to give you a moment because the next little test is not super pleasant. I'm going to elicit the gag reflex by very gently touching it with the tongue depressor. You're not going to throw up, but we're just going to get that little bit there. And that is an important reflex to make sure it is intact. If I could have you open your mouth. Okay, I'll be very quick, very gentle. Okay, yeah. Not fun, so you can have a moment. Not fun at all. And then after that, we will do something much easier. And I'm just going to have you take a dry swallow so that we can further test cranial nerve 10. So if you could just do just like that and tell me if there's any issue, any pain, any sort of dysfunction at all. Okay, and that was just fine. Good, okay. So we are going to now move on to the neck. We're going to do a little bit of range of movement testing. We're going to do cranial nerve 11. We're going to do a little bit against resistance. Look at the thyroid, the trachea, and the lymph nodes. So I'm going to have you start by extending the neck by lifting the chin. Okay, and again. Good. Now I am going to put my hand on your head, and I'm just going to have you do that even though I'm pressing down on your head. So do that against resistance. Okay. So right in here. Now can you extend the neck? Good. Okay. And now if you could flex the neck forward a couple of times here. Good. And I'm going to keep my hand under your chin, and I want you to continue flexing even with the resistance. Okay, right here. Go ahead and just. Okay, so good strength there. Can I have you turn to one side? Good. I'm going to put my hand right here. I want you to keep turning your head against my resistance. Okay. Good. Other side here. Turn. Turn. Good. And turn against my resistance here. Good. And now we're going to tilt that. Tilt to one shoulder. Just like that. Good. I'm going to put my hand here, and you continue to tilt against my resistance here. Tilt that. Okay. Other side here. Tilt. Tilt. Yep. And then if you could tilt against resistance. Very good. Now we'll do the shoulders. This is for the accessory nerve, cranial nerve 11. I'm just going to have you shrug the shoulders a few times here. Good. And I'm going to put my hands on the shoulders, and I want you to shrug them against my resistance here. Now if you could shrug up Okay, good. So, good strength in the neck and the shoulders here. So, I would like you to turn your head to your left. This is my left. And we are going to look at the jugular venous pressure. So, I'm going to have you turn your head to your left. And I'm just going to watch this area. Just going to watch this little area here. And you don't have to do anything. Just looking at the pulsation here. The pressure in the neck, in this jugular vein. It's a nice moment to just have a breath. Okay, I'm quite satisfied with that. And now let's look at the trachea, the thyroid, and the neck in general. So, for the thyroid, I'm going to have you take another dry swallow, okay? I'm just going to put my fingers right here, and if you could swallow for me. There we go. Good. While I'm here, this is a little uncomfortable, but I'm just going to feel the trachea. Make sure it's midline. There's no deviation. Do you ever happen to pop your trachea at all? It sounds a little strange, yeah. Well, so I have something called Ehlers-Danlos syndrome, which means that basically all my tissues are not held together as much as other people's are. So a lot of times, something inside my trachea will just snap, and I have to turn my head to get it to snap back into place. And you know, I can move my trachea a lot more than the average bear. Fun at parties. Okay, and I am just gonna look at the muscles in the neck. So if I could have you turn to one side, we'll get that sternocleidomastoid muscle. Okay. And the other side for me, please. Good. This little triangle here. Okay, and go ahead and just come back to midline. And that looks good. So, let's do the lymph nodes and the carotid artery as well. So, we'll start behind the ears. And in front of the ears, just rolling the skin here. Underneath the jaw. Submental, submandibular nodes. And we have our anterior cervical, posterior cervical, deep cervical chain, lymph nodes in the neck. And then right in here are supraclavicular nodes. And those feel normal as well. No swelling, which is good. Let me grab the stethoscope. And I'm going to auscultate the carotid artery, which means that I'm going to take a listen to the artery for any bruits, which are audible heart murmurs, and that way I know it's safe to palpate the carotid arteries. So I'm going to do this one side at a time, and if I could have you take a breath in and hold it so that I don't hear the air whistling through the trachea. Okay. deep breath in. Hold. Exhale. The other side. Deep breath in. Hold. Exhale. Very quick. Very quick, very easy. And we are going to just do one last little bit of palpation. I'm going to feel the carotid artery now that I know that it's safe to touch that. So, one side at a time. And you don't need to do anything special here. Just breathe. Okay, the other side. Excellent. So that was our last little test. Now, everything looked great on the head and neck assessment. All your cranial nerves look great, as well as your eyes, your scalp, nose, mouth, throat, all of that. So I'd like to thank you so much for coming in today for this head and neck assessment. I hope you have a whale of a day and a good rest of your night. Thank you. Thank you so much for watching. I really appreciate it. And a big thank you to my patrons on Patreon, without which I wouldn't be able to make these videos. If you want to help support the channel, there's a link to my Patreon in the description box below. I offer perks like early access to videos, ad-free access to videos, Patreon exclusive videos, audio downloads of all my content. Thank you for being here. I hope you have a whale of a day.